CDC says monkeypox infections are expected to rise because it's getting easier to test and now report cases. It can take up to 3 weeks in part here to confirm an infection. Officials warn everyone is at risk. Monkeypox can be spread by close contact and contaminated surfaces. State health officials say they've identified a dozen cases of monkeypox and counting. News 12 Connecticut's Sean McCabe is more on who's most at risk and what you need to know tonight.
We are going to identify more cases probably every day going forward now.
The Connecticut Department of Public Health says it's identified 12 cases of monkeypox in the state so far. They say the LGBT community is disproportionately affected.
Current cases are primarily spreading in social networks of gay, bisexual, and other men who have sex with men.
Almost all of our cases that we've seen have been painful genital lesions, is really the presenting sign and symptom.
Dr. Scott Roberts is an infectious disease doc with Yale Medicine. He says, thankfully, most cases in the state so far have been mild.
It's really been pain management and really focusing on having these patients isolate and avoid sexual contact or really close prolonged contact with anybody.
Doctors say the infection usually spreads through skin-to-skin contact. Officials say testing capacity is getting stronger, with 4 corporate labs stepping up to help this week.
We are now going from 10,000 tests per week as a capability to 50,000 tests per week as a capability.
Taking a lesson from the COVID-19 response, officials say more testing means more containment.
The more you can identify the cases, the more you can contact trace and hopefully limit the spread of this infection further.
Limited vaccine supplies reserved for close contacts. Officials say the shots can prevent infection even after you've been exposed.
Our first goal is to get people within the first 4 days of their exposure to try to get them a vaccine to prevent infection altogether.
And we can actually give the vaccine up to 14 days after exposure to prevent monkeypox. If it does occur, it would be much more mild.
Sean McCabe, News 12, Connecticut.
Health officials say the virus likely spread into Connecticut from New York, where CDC says several hundred cases are identified. The federal government is buying another 2.5 million doses of that vaccine.